So I'm going to try to make this doctor's appointment update, but I've had two little ones that have made this very difficult. So they've all been kind of sick, so they've all been kind of, yeah. So let me get right into the appointment. It was on Monday, and it was a scheduled appointment. It was my first long prenatal appointment. So we did an ultrasound. The heartbeat was 139, which she said was good. So, she was very happy with that. And of course, when you go, at least my doctor's office, they give you a big folder of, don't do this, don't do that. If you have this problem, do this, and all that type of stuff, and all the information for the screenings for birth defects and things like that. We are having an NT scan done. Now, the reason we're having it done, because I know a lot of you guys are going to go, well, if it's your third baby and you didn't have a problem with your first two, I had it done with my son, and I wanted it done with my daughter, but the doctor I had said, oh, no, you don't need it. And my brother, he was, when he was born, the sac inside his head was was on the outside of his head, so when he was 2 days old, they did surgery. And, my parents, of course, were told, any other child that they had would have it, and that my brother could be completely brain dead. He might only live, if he lived to his first birthday, that they were lucky. And, well, I'm very happy to say my brother is not brain dead. He's perfectly normal, and he's, I think he just turned 28, so he's fine. So, anyways, because of that, when I was pregnant with my son, I told my doctor that, they said, well, we're going to do it just because we want to check. Now, when I said it to my doctor when I was pregnant with my daughter, he said, no, you still don't need it. Well, when I went, to this one, same practice, just it was my regular doctor, and she said, I explained what happened with my brother. She said, she's like, well, we're going to do the NT scan. And I said, okay, well, isn't that just really for Down syndrome and that type of stuff? And she said, no. She said, we can actually see the formation of his head. She's like, the whatever disorder or whatever defect that it is. She said, she's like, it's like she said, for a normal person, it's like a 1 in million, bazillion chances if it can actually happen. She said something with my brother, just their chromosomes matched up just perfectly that he was born with it. But like she said, doesn't mean that I won't because of my brother. So she said, she's like, let's be on the safe side instead of, because like she said, that will play a huge factor in a VBAC or a repeat C-section. Because she said, if it's that way, she said, I'm surprised your brother was born alive. And my mom said her doctor too was very surprised because my brother very well could have died during labor. So we're having an NT scan done, but we're also having a level 2 ultrasound done because she wants to kind of, because of that, and because of the risk of the miscarriages, and being, of course, the first trimester high risk, when I see the high risk doctor, they're going to do a level 2 ultrasound. When I see her or any of the other doctors, they just do a regular, level 1 ultrasound. But like she said, once we get to 10 weeks or 11 weeks, she's like, they might just use the Doppler and then just do the high risk ultrasounds. But that's really all that we talked about was the NT scan. We talked a little bit about the VBAC, and more or less the backup plan, which I'll make a video separate about that. Now let me talk about the weight, because this has been a problem. Since we found out I was pregnant, we've lost 10 pounds. I've also had a really bad cough where I've been throwing up, but now I'm throwing out without coughing, and I'm coughing and I'm throwing up. So it's, ugh. But I'm happy. I'm totally happy to be pregnant, so I'll put up with it. But my doctor's more concerned than I am. Over the weekend, because I had an appointment on Friday, and I had an appointment on Monday, and I lost 2 pounds. So they're a little bit concerned. The high-risk doctor wants me to come in on Friday for a weight check and possible ultrasound, but he said probably not. They're probably just going, he said, depending on how bad, he said if there's a drastic weight loss, then they're going to do an ultrasound to make sure the baby's okay, and then IV fluids just so that way I stay hydrated. And then they're going to try to figure out a plan of what we're going to do about me getting sick. He thinks that it, should be treated pretty easily with medications, but he just, like he said, he doesn't want to just throw the medication at me without giving me a couple days to try to put some weight on, or at least, maintain, where I'm at. So my next appointment, like I said, I have a weight check Friday, and then I have my high-risk appointment on Tuesday with him for a level 2 ultrasound for dating. Now that's where my updates are going to stay the way they are until I have the exact date, because I don't want to change it on you guys now and then have to change it again. I'd rather change it the one time, because that will be the official, this is your due date. Basically with my VBAC, they will not let you go over 40 weeks after 2. And I understand, because there's a very high risk of uterine rupturing, and my husband and I, we've talked about it. I'm okay with that. So before people put, oh, well, no. I'm okay with it. My husband's okay with that. It's for the safety of the baby and for myself. If I don't go into labor by 40 weeks, I'm okay with that. But other than that, we're doing good. So I'll talk to you guys on Saturday after my doctor's appointment, and I'll include my update. So I'll talk to you guys later.